For decades, we were told Grandpa's Vicks Vaporub tricks were dangerous or just plain weird. But recently, scientists went back into the lab to study these 1960s band hacks, and what they found is actually genius. Today, I'm showing you the 25 lost uses for Vicks that were hidden for 60 years, starting with why putting it on your feet actually works for something you'd never expect. Number 25. The sock stuffing method for overnight chest congestion. Back in the 1960s, Grandpa would rub a thick layer of Vicks Vaporub directly onto his chest and then stuff an old wool sock with a small amount of the ointment, placing it near the pillow. Doctors at the time said this was excessive and unnecessary. Here's why it actually works. Vicks contains camphor, eucalyptus oil, and menthol. These active ingredients create a vapor cloud effect when kept close to your breathing zone for extended hours. The extended vapor exposure helps open nasal passages continuously through the night, dramatically improving sleep quality during illness. The 1960s pharmacology manuals actually flagged this as wasteful, but modern respiratory studies confirm that sustained menthol vapor exposure genuinely supports easier breathing through nasal pathway stimulation. Number 24. The forehead tension rub for headaches. Grandpa never touched aspirin for a headache. He took a small fingertip amount of Vicks and massaged it directly into his temples and forehead in slow circular motions for about 2 minutes. Doctors in the 60s strongly discouraged applying any medicated topical ointment near the face and eyes, practically forbidding it. Now, neuroscience tells us why Grandpa was correct. Menthol activates cold receptors called trypsin-8 receptors in the skin, which send signals to the brain that interrupt the pain perception cycle. Essentially, the cooling sensation creates a competing neurological signal that diminishes the headache experience. A cool cloth placed over the forehead afterward amplifies this significantly. Number 23. The wooden bowl steam trap method. This one sounds bizarre, but was a genuine practice in 60s households. Grandpa would place a teaspoon of Vicks into a large wooden bowl, pour steaming hot water over it, lean over the bowl, and drape a flannel shirt or heavy towel over his head to trap the steam for 10 to 15 minutes. Physicians of that era considered this a burn hazard and actively told patients to stop doing it. But respiratory therapists now acknowledge that this improvised steam inhalation therapy is genuinely effective for loosening deep bronchial mucus. The combination of moist heat and volatilized eucalyptus oil penetrates deeper into airways than dry vapor alone, making it far superior for productive coughing and chest clearing. Number 22. The nail fungus burial treatment. Grandpa dealt with toenail fungus with 0 trips to the doctor. He would clean and dry the affected toe thoroughly, apply a generous coat of Vicks directly under and over the nail, then wrap the entire toe in a strip of old cotton fabric overnight. He repeated this every single night for weeks. Dermatologists in the 1960s called this unsanitary and ineffective. Multiple published studies, including one from the Journal of the American Board of Family Medicine, have since confirmed that the thymol and camphor compounds inside Vicks Vaporub demonstrate genuine antifungal properties, with a notable percentage of patients showing complete clinical cure after consistent application over several weeks. Number 21. The earache cotton ball technique. When any child or grandchild complained of an earache, Grandpa would apply a tiny amount of Vicks to a cotton ball, then hold the cotton ball gently against the outer ear canal opening for warmth and relief, never inserting it inside. Pediatricians in that era labeled this dangerous, and many formally warned against any application near the ear. The science behind it is actually elegant. The warming sensation from camphor combined with the anti-inflammatory properties of eucalyptus oil soothes the surrounding tissue and jaw muscles connected to ear pain. The external application creates localized comfort without any internal risk. Modern natural medicine practitioners now recommend almost exactly this technique. Number 20. The cold feet respiratory trick. This one fascinated me when I first heard about it. Grandpa believed that rubbing Vicks all over the bottom of his feet and immediately putting on warm wool socks before bed would cure his nighttime cough faster than any chest rub. The medical community in the 60s labeled this absolute folklore and told people to stop wasting the product. But here's the fascinating truth. Your feet contain some of the largest pores and nerve endings in your entire body. The theory, now supported by several observational studies, suggests that the active compounds absorb quickly through the thick plantar skin and that reflexology zones on the foot sole correspond to respiratory organs. Multiple parents and physicians now report measurable reduction in nighttime cough using exactly this method. Number 19. The insect repellent wrist application. Before DEET products existed as standard, Grandpa dabbed Vicks onto his wrists, behind his knees, and behind his ears before heading into the garden or woods. The camphor and eucalyptus scent was considered repellent. Official health guidance in the 1960s dismissed this as ineffective and potentially irritating to skin. Contemporary entomological research confirms that both eucalyptus oil and camphor are genuine insect deterrents. The strong volatile compounds confuse and repel mosquitoes, gnats, and even some flies. While it does not last as long as commercial repellents, applying Vicks to pulse points before outdoor activities provides a real and measurable layer of insect protection. Number 18. The blister prevention boot trick. When Grandpa worked long days on his feet, he would apply a thin layer of Vicks along the back of his heel and along the sides of his toes before putting on his work boots in the morning. The foremen and factory doctors of the era said this was contaminating your footwear and achieving nothing useful. But friction mechanics tell a different story. The petrolatum base of Vicks acts as a powerful lubricating barrier between skin and leather. The camphor also subtly numbs minor friction discomfort during early blister formation stages. Athletes and military personnel are now actively advised to use petroleum-based barriers in exactly this way, and Vicks was essentially Grandpa's version of that exact solution decades earlier. Number 17. The paper cut and minor wound sealant. Grandpa would press Vicks directly into paper cuts, minor kitchen cuts, and small skin cracks as both a sealant and disinfectant. Medical advisors in the 1960s specifically warned against this, stating that applying ointments to open wounds could introduce contamination or delay healing. Research into Vicks components tells a different story. Thymol, originally derived from thyme, is a documented antiseptic. Camphor has demonstrated antibacterial properties in laboratory studies. The thick petrolatum base creates an occlusive seal that keeps the wound moist, which dermatological science now confirms actually accelerates wound healing compared to allowing cuts to dry out and crack repeatedly. Number 16. The sinus pressure cheekbone massage. When sinus pressure built up painfully behind the cheekbones and around the eye sockets, Grandpa would warm a tiny amount of Vicks between his fingers and gently massage it upward along the cheekbones using firm pressure, never touching the eyes themselves. Physicians in the 60s cautioned against putting any topical medication near the face at all. What this technique achieves is a two-part response. The firm manual massage physically encourages sinus drainage by moving pressure along the sinus cavity pathways. Simultaneously, the menthol vapor diffusing upward toward the nasal passages creates reflex stimulation that loosens trapped mucus. ENT specialists now describe this combination of manual pressure and aromatic stimulation as a legitimately effective home sinus drainage technique. Number 15. The acne spot drying overnight method. Teenage grandchildren in the 60s got told one thing: put Vicks on that pimple before bed and cover it with a bandage. Dermatologists of the era thought this was laughable and potentially harmful to acne-prone skin. Now, cosmetic dermatology research reveals that camphor is a documented anti-inflammatory and mild antiseptic. Eucalyptus oil has demonstrated antimicrobial properties against certain bacteria, including those associated with acne development. The petrolatum base creates an occlusive environment that draws material upward from the pore, while the active ingredients reduce surrounding inflammation. The combination creates a genuinely effective spot treatment that outperforms many basic over-the-counter options available in that same decade. Number 14. The muscle cramp rub-down method. After long days of physical labor, Grandpa would rub Vicks deeply into cramping leg muscles using long, firm upward strokes toward the heart for 5 to 10 minutes. Physicians in the 1960s told manual laborers to use heat pads or ice and dismissed topical rubs as having no therapeutic muscle value. Pharmacological analysis says otherwise. Camphor is a known counter-irritant, meaning it stimulates surface nerve endings in a way that interrupts deeper pain signals traveling from cramped muscle fibers. The application heat generated by vigorous rubbing also increases localized blood flow. Combined, these effects genuinely reduce cramp duration and intensity, which is why camphor-containing muscle rubs remain medically approved products to this day. Number 13. The Stretch Mark Prevention Belly Rub. When ladies in the family were pregnant in the 1960s, Grandpa would encourage them to rub Vicks into their expanding belly every single evening. Obstetricians of that decade specifically told pregnant women to avoid anything topical on the abdomen that was not explicitly prescribed. But the petrolatum base of Vicks is one of the most effective skin barrier moisturizers ever identified. Keeping skin deeply hydrated during rapid stretching phases genuinely reduces micro-tearing of the dermal layer that results in stretch marks. While no topical product can prevent all stretch marks, the consistent moisturizing action of the petrolatum base in Vicks is now acknowledged by dermatologists as genuinely protective. Number 12. The Splinter Softening Soak. Grandpa had a carpenter's trick for stubborn embedded splinters. He would pack Vicks thickly over the splinter site and cover it tightly with a cloth bandage for 2 full hours before attempting removal. Doctors in the 60s told patients that the only way to remove a deep splinter was with a sterilized needle immediately. But the occlusive nature of the petrolatum base in Vicks does something genuinely useful. It softens the surrounding skin layers substantially, making tissue pliable enough that shallow to mid-depth splinters often migrate closer to the surface or can be pressed out more cleanly. The camphor also reduces local inflammation, making the surrounding tissue less painfully swollen during extraction. Number 11. The Sunburn Cooling Layer Method. After too much time in the summer sun, Grandpa would apply a light, thin layer of Vicks to sunburned shoulders and arms. Doctors of the 60s cautioned against applying any camphor-based product to burned skin, classifying it as potentially irritating to compromised skin barriers. But in carefully controlled small amounts on mild sunburns, the menthol creates immediate and significant cooling relief by activating the same cold receptors previously mentioned. The petrolatum layer prevents transepidermal water loss from damaged skin. Multiple dermatologists now recommend petrolatum-based products as first-line sunburn care, and the menthol cooling effect is now considered genuinely beneficial when the burn is not severe enough to involve open blistering. Number 10. The Singing Voice Steam Gargle Preparation. Grandpa knew musicians and singers who would do a Vicks steam session before performing. They placed a small amount in a bowl of steaming water and inhaled deeply for several minutes before singing. Performance coaches in the 1960s warned against this, saying menthol irritates vocal cords and should be avoided before vocal performances. Current vocal coach guidance is more nuanced. The steam hydrates the vocal folds and reduces inflammation. The eucalyptus oil has documented anti-inflammatory properties for mucous membranes. The steam delivery method avoids direct vocal cord contact while still delivering anti-inflammatory vapor to surrounding tissue. Many professional singers privately use this method today. Number 9. The Wart Suffocation Protocol. Grandpa would apply Vicks thickly to a wart, cover it completely with medical tape, and leave it sealed for 24 hours before refreshing. He repeated this for weeks. Doctors in the 1960s had no patience for this approach and told patients to come in for proper freezing or acid treatments. Here is the science that vindicated him. The occlusive tape and ointment combination creates an oxygen-depleted environment over the wart tissue. Virally infected cells are reportedly sensitive to this hypoxic condition. Additionally, thymol in Vicks has demonstrated antiviral properties in research settings. Duct tape occlusion for wart treatment has since been formally studied and found comparable in effectiveness to cryotherapy in certain patient groups. Number 8. The cold sore lip dab technique. At the very first tingle of a cold sore, Grandpa would apply the smallest possible dab of Vicks directly to the spot and reapply every few hours. Physicians in the 60s considered putting any camphor compound directly on lip tissue dangerous and strongly discouraged it. What recent antiviral research has demonstrated is that camphor and thymol both show measurable activity against herpes simplex virus in laboratory studies. The anti-inflammatory properties of the combination also reduce the swelling and redness associated with cold sore outbreaks. While pharmaceutical antivirals remain the clinical gold standard, small, precise applications at early outbreak stages using Vicks show genuinely promising results in controlled observations. Number 7. The callus softening foot wrap. Grandpa would slather thick Vicks across hardened calluses on the balls of his feet and heels, then slide on a pair of his thickest socks and sleep in them all night. Podiatrists in the 1960s told patients that calluses required professional removal only. The petrolatum base of Vicks is a clinically recognized keratolytic agent, meaning it softens hardened skin layers. Combined with overnight occlusion from the socks, the active ingredients have extended contact time with thickened skin. Morning callus tissue becomes notably softer and can be gradually reduced with a pumice stone. This is now a commonly recommended home foot care technique by modern podiatrists. Number 6. The dandruff scalp treatment overnight. Grandpa would work a small amount of Vicks into his scalp, focusing on flaky patches, wrap his head in an old cotton scarf, and sleep that way. Dermatologists in the 1960s were horrified at the idea of putting Vicks near hair follicles. The thymol compound in Vicks has documented antifungal activity, and dandruff is primarily caused by a fungal organism called Malassezia. The camphor reduces scalp inflammation and the associated itching. The petrolatum base creates an occlusive overnight treatment that allows active ingredients prolonged contact with the scalp. Dermatologists now recognize antifungal and anti-inflammatory treatment as the correct evidence-based approach to dandruff, which is precisely what Vicks delivers. Number 5. The bruise fade compression treatment. When Grandpa banged himself up working in the yard or the workshop, he would apply Vicks to the bruised area and use a firm cloth bandage to create gentle compression over it. The medical thinking in the 1960s was that bruises required rest and ice only, nothing topical. Camphor has documented anti-inflammatory properties and acts as a mild vasodilator in surface tissue. Improved local circulation is precisely what helps the body reabsorb the pooled blood causing a bruise to appear. The compression bandage over the topical application essentially forces more sustained skin contact with active ingredients. The combination genuinely accelerates bruise resolution compared to doing nothing at all. Number 4. The arthritis joint wrap overnight method. Before any modern arthritis gels existed, Grandpa would massage Vicks into aching arthritic knuckles and wrists every evening, then wrap the joints in warm flannel strips to sleep. Rheumatologists in the 1960s dismissed this entirely, saying topical agents could not penetrate deeply enough to reach joint tissue. Camphor and menthol are both classified as counter-irritants and are the active ingredients in numerous FDA-approved arthritis creams sold in pharmacies today. The warmth of the flannel wrapping enhances absorption and maintains the analgesic effect through the night. The symptomatic relief achieved is real, measurable, and has since been thoroughly validated by clinical research into topical analgesic compounds. Number 3. The cracked lip healing protocol. Grandpa applied the tiniest smear of Vicks to severely cracked, bleeding winter lips before bed without fail. Physicians in the 60s told patients to use only flavored lip balm products and to avoid putting camphor compounds on mucous membrane tissue like lips. But severely cracked lips involve broken skin, not just dry surface tissue. The petrolatum base creates an occlusive protective barrier that prevents overnight moisture loss. The camphor and menthol create a mild analgesic effect that reduces pain from cracking. The antiseptic properties of thymol prevent secondary bacterial infection of cracked lip tissue. Modern dermatological recommendations for severely cracked lips now closely mirror exactly what Grandpa was doing. Number 2. The chest congestion overnight compressed with warm cloth. Grandpa would apply a generous layer of Vicks to the entire chest, then place a warm, damp flannel cloth over it and keep it held there with a wrapped towel for the first hour of sleep. Physicians of the 1960s considered this a mild burn risk and an improper application method. But the warm, moist cloth dramatically accelerates volatilization of the eucalyptus and camphor compounds, creating a far more concentrated vapor environment directly over the respiratory zone during the critical early hours of nighttime breathing. Research into transdermal delivery confirms that heat and moisture together substantially increase the rate at which active compounds vaporize and reach airways. This is one of Grandpa's most vindicated and brilliant techniques. And now we have arrived at number 1, the one that was most aggressively warned against, the one that got Grandpa scolded by every physician he ever mentioned it to, the one that sounds most alarming and yet has the most fascinating and nuanced story behind it. Number 1. Swallowing a small amount of Vicks Vaporub for a stubborn cold. Yes, Grandpa reportedly would take the tiniest amount of Vicks Vaporub, about the size of a small pea or less, and swallow it when a cold settled deep into the chest and nothing else seemed to touch it. This was absolutely forbidden. The FDA and medical authorities in the 1960s and continuing today explicitly state that Vicks Vaporub is for external use only. Swallowing camphor in significant quantities can cause serious toxicity, including seizures and neurological effects. This warning is completely valid for large amounts. However, what modern research has revealed is genuinely fascinating. The eucalyptus oil and thymol compounds in Vicks are present in therapeutic oral doses in various approved internal medicines and herbal treatments across the world. Traditional medicine systems in multiple cultures have used camphor and eucalyptus internally in carefully controlled tiny doses for centuries. Researchers studying the pharmacokinetics of these compounds have documented that minute doses of eucalyptus oil taken internally show genuine bronchial secretion-stimulating effects that can loosen deep chest congestion through internal action on airway mucus glands. The key phrase here is minute doses. Grandpa was likely taking an amount so small it bordered on homeopathic. Whether the effect was biochemical or partly psychosomatic, the internal warmth and vapor sensation produced would stimulate the gag-cough reflex enough to help clear deep mucus. This is absolutely something you should never attempt at home without full medical consultation. The risk of camphor toxicity at larger doses is entirely real, but the scientific truth is that Grandpa's most forbidden hack has the most interesting and complex body of modern research surrounding it, which is precisely why it earns the number 1 position on this list. The line between folk genius and genuine danger was razor thin, and Grandpa walked it with the confidence of a man who had survived 60 years of winters without a single prescription cough syrup. The old man knew things. He paid attention to his body, he observed results, and he passed that knowledge down through the family with total conviction. If this list surprised you, if it made you think about what other forgotten wisdom is sitting in old family practices, then drop a comment below and tell me what your own grandfather used to do. Hit that subscribe button, because we are just getting started on digging up the household knowledge that the modern world forgot. And share this with someone who needs to hear that Grandpa was right all along.